Hi, everyone. Thank you for your interest in and application for the Master of Science in Global Health program at Duke University. This video is meant to introduce you to our program components ahead of the virtual open house, which will feature panels with faculty and current students. We will record each panel so that you can come back to it, and we will also be available for individual meetings to talk through your questions about the program, Duke, and Durham. I'm Sarah Martin, the Assistant Director for Graduate Admissions at the Duke Global Health Institute. I've been in this role since the program began in 2009. It has been my absolute honor to watch this program evolve over the past decade. Before coming to Duke, I worked at a small school in Vermont that facilitated international education programs focused on critical issues around the world. At Duke, I am fortunate to be in an environment where I can continue to learn and engage with critical issues focused on global health through my work with our students, alumni, staff, and faculty. I hope to share some of what makes Duke unique with you today. In 2009, in a Lancet article, a group of leaders in global health defined the field as follows. Global health emphasizes transnational health issues, determinants, and solutions. It involves many disciplines within and beyond the health sciences and promotes interdisciplinary collaboration, and is a synthesis of population-based prevention with individual-level clinical care. More recently, in June 2016, the Journal of Global Health has proposed a definition of global health based on 6 core principles: a cross-border multi-level approach, inter or transdisciplinarity, systems-based thinking, innovation, sustainability, and human rights and equity. To the last point, the Global Health Institute, inspired and encouraged by our students and alumni, is currently in the process of expanding our curricular focus on decolonizing global health and anti-racism, topics with significant importance in exploring health equity, both locally and globally. The mission of the Duke Global Health Institute is to reduce health disparities worldwide through education, research, and service. We work to prepare leaders, seek solutions, and partner for change. Reflecting both the definition developed in the Lancet and the principles of academic global health stated in the Journal of Global Health, Duke offers one of the most comprehensive global health education portfolios of any institution in the United States. We are leading the field of global health research training at all levels, from undergraduate to postdoctoral programs. With faculty spanning disciplines and schools across Duke University, the Global Health Institute is able to focus on developing impactful research questions and teams to understand and address some of the most important issues of today. DGHI hosts and/or cooperates with 8 research centers to coordinate and enhance collaboration on emerging health priorities. Duke and DGHI faculty have launched innovative initiatives, such as the Center for Women's Health Technologies with our School of Engineering, and a Center for Policy Impact in Global Health with our School of Public Policy. Of course, there's also a lot of good research on topics related to COVID right now at Duke, spanning all disciplines, not just the medical sciences. The centers and the faculty that lead them are a great resource for students as research mentors and thought leaders in our community, organizing symposia, working groups, and other opportunities throughout the year. The Master of Science in Global Health was one of the first major initiatives after the Institute formed over 10 years ago in 2006, actually 15 years ago. Our first class began in 2009 with with 17 students, and we welcomed our 12th cohort of 37 new students this past August. While DGHI has over 100 faculty members across campus, there is a smaller group that is dedicated to teaching and mentoring our students. These faculty are both experts in their fields and approachable, and they've built a supportive environment in which to develop an interdisciplinary foundation and research methods skill set that will allow you to make an impact in the field of global health. Combining the best of theory and practice, structure and flexibility, we allow students to build academic programs that fit their interests and place for the future. We aim to admit students who will create rich discussions in the classroom, have varied interests and perspectives, and who hold a commitment to improve health outcomes for people and communities locally and around the world through research, service, and innovation. Our typical cohort or class size is around 30 to 40 students. And the average Master of Science student has had a few years of research or work experience, has spent time working or volunteering in underserved communities in their home country or abroad, and has performed well as an undergraduate student. You can be assured that your peers in the program will be interesting, engaged, and focused, but you should also expect to be challenged to think through issues of global health through a lens that is different from your own. This is a really good graphical overview of our curriculum over the 2 years that you will study at Duke. It's also available on our program website. We place an emphasis on core coursework in the first year of the program and elective coursework and preparation of your master's paper or thesis in the second year. In your first year, you will focus on building foundational skills for working in global health settings broadly defined. The ability to assess research methods and choose appropriately for your project or context, skills in biostatistics and epidemiology, an understanding of global health systems function, applied and historical frameworks for ethics in research and community engagement. You complement the core courses with electives of your choosing. Two of your electives must have a methods focus to deepen your toolkits for performing global health research. But while you might be interested in qualitative methods, a peer may be more interested in quantitative methods, and there are courses for both of you available at Duke. Likewise, while you may be interested in environmental health, another student might be more interested in non-communicable diseases or global mental health. There are electives for both of you at Duke. DGHI students can identify graduate courses to bolster their interdisciplinary understanding of global health from across the university. Altogether, you must take 11 courses, 6 required courses and 5 electives to earn the Master of Science at Duke in global health. Non-native English speakers may have additional English for international students course requirements, usually 1 to 2 courses. Our degree is conferred by the Duke Graduate School. As you'll see in this graphic, it is possible to finish in 1.5 years, but most students will stay for 2 full academic years to take full advantage of Duke resources and opportunities. Graduate certificates in innovation and entrepreneurship, international development policy, GIS skills, and area studies complement your core coursework if you are so inclined. And as you'll see, research mentorship crosses both years of the program, which is a distinguishing characteristic of Duke. Between the first and second year of the program, students undertake a field-based research or internship project under the mentorship of a Duke faculty member. This is the hallmark of Duke's program and one of our most unique features. You will develop the project over the course of your first year, learning proposal writing, about the ethical review process, and project management skills. Most students also undertake a paid research assistantship with their research mentor during that first year, allowing you to dive deeper into the research topic and process. This year, we are also piloting a few practica or internships that will allow students with more substantial previous international experience to work with organizations for their fieldwork project. We hope to continue and expand these opportunities in the coming years. The assistantship and pathway match process takes place early in the first fall semester. We introduce you to opportunities with faculty and global health organizations, and then we facilitate applications and interviews and eventually make the match. Our students typically start working following that match, giving you an extended window into the research process to build relationships with your faculty mentor and partners and collaborators, and to gain expertise and experience with your research topic. You will start building your own research project during this first year as well. In the spring, we also offer a weekly course to further your preparation for fieldwork and to introduce you to the breadth of resources available through Duke and DGHI. Duke gives every student funding to pursue their field-based research or practicum, and your fieldwork becomes the basis of your master's thesis or academic project. As you have surely experienced in your own life, COVID restrictions on travel and global engagement have impacted our approach and emphasis on applied fieldwork. Many of these projects have in the last 2 years shifted focus to become virtual for the near future. We hope that as vaccine access and therapeutics become more widespread, we will resume placing students in hands-on field-based or organizational settings, but we will take the lead of our domestic and international partners, as well as complying with Duke and US travel guidelines and recommendations. The education team and advising model at Duke seeks to ensure that students have a variety of people to support them along their educational journey. In addition to your research mentor with whom you will connect during that first semester, you will have a program level faculty advisor and an education team staff advisor or student services coordinator who will act as your first point of contact for any questions you have about the program and accessing resources at Duke. Duke offers a tremendous amount of academic and personal support beyond the Global Health Institute, including the offices and resources listed here. We are especially proud of the research support available at Duke, both within the Global Health Institute through our Research Design and Analysis Core, and through the Duke libraries with specialized subject area librarians and hands-on data visualization workshops and individualized support. In normal years, our students have also done things like camped out for basketball tickets, volunteered with local agencies, and participated in initiatives with other graduate students across Duke, such as the Refugee Health Initiative and Bass Connections projects. Opportunities to engage with peers at other local universities are also available. COVID has had a significant impact on the student experience this year, but many of the opportunities and benefits of being a Duke student still exist in a virtual format, and we're sincerely hoping for a return to some sense of normalcy in this coming year. Master of Science alumni, actually Master of Science students, have opportunities to engage through local networks and with a vast array of experts visiting Duke from around the world each year. University-wide resources complement those available through DGHI. Graduates of our program fan out to positions that often combine pre-program experiences with their time at Duke. Most have pursued careers in global health research in academic and NGO sectors, though several are also building careers in policy with national and international agencies. Those with prior medical training are continuing on a clinical pathway, often adding research into their portfolio. Around 40 to 50% of our graduates will eventually pursue education in fields such as medicine, implementation research, engineering, epidemiology, psychology, and more. A few have also gone on to programs in law and business, combining that training with their commitment to global health equity. Durham and the Research Triangle area are great settings in which to study global health. We have an active and growing area network that brings together research organizations, pharmaceuticals, universities, government agencies, faith-based organizations, and others with a vested interest in the field. Durham is also simply a great place to live. We have good weather, access to outdoor recreation, amazing restaurants and cultural activities, and importantly, an active social dialogue with lots of opportunities for Duke students to get involved in community activities. We will post a few virtual campus tours and related videos to our admitted students website for you to explore. In summary, DGHI and Duke's Master of Science in Global Health program offers core training focused on interdisciplinary foundational knowledge and methods for global health work and research. Our faculty are innovative, engaged, and supportive of student learning, as are our education team staff. Electives are flexible and derived from across Duke's graduate school and professional schools, and students will gain valuable soft skills through our program, through teamwork, presentation and writing skills, and all the other opportunities to be involved on campus. Thank you, and we look forward to hearing from you and answering your questions at the open house next week on March 30th or in an individual meeting. Thank you.